You're right, planks really aren't a great idea if you have diastasis recti during your pregnancy. But you're probably wondering, how do I do my favorite workout class? How do I keep up with core strengthening if I can't do planks? I have a great answer for you and I'm going to show it to you in this video. My name is Dr. Nicole. I'm an obstetric pelvic floor physical therapist, which means I specialize in working with women during their pregnancy and postpartum to make sure that their pelvic floor and their core are as strong as they can possibly be. And I get so excited when clients ask me, how can I keep my core strong if I have diastasis recti? I don't think I should be doing planks. It feels like I'm seeing that bulge when I do planks. What can I do instead? This is a great question because most of the modifications that you're going to see out there are when you're going down onto your elbows or going down onto your knees to make the plank easier. But when we're pregnant, that still leaves a lot of weight on our ab muscles that are already separated and pretty weak to begin with. So there is a better modification out there. In this video, you can see that I am doing a plank in a different position that you might normally do. I'm actually elevating myself. So I'm still in that nice straight line. I'm propped up against a wall. If you wanted it to be more challenging, you would put yourself down a little bit lower, maybe use a really strong, not gonna move table, a coffee table, a couch or something like that. The lower the surface, the more challenging it's gonna be, the more upright you are, the easier it's going to be. Once you're in that elevated position, you get into the normal plank position. Now it might feel a little bit easy to just do a regular plank from this position. How you can make it a little bit more challenging is by doing different things with your arms. So one of the things I recommend you do is you go up the wall with one hand, out to the side with that hand, back to the middle, up and out to the side. Just moving your arms will force your core to really engage to keep yourself stable while your arms are moving. Another modification that you could do to make this a little bit more challenging, even though you're elevated, you could also do shoulder taps where you're alternating your right arm to your left shoulder and your left hand to your right shoulder back and forth. And again, you have to maintain that stable core while you're moving your arm. Elevating your plank is one thing that you can do during your pregnancy to keep your core nice and strong. Another thing you can do is to make sure you're using your breath and involving your pelvic floor in exercises so that your whole core system is really, really strong throughout your pregnancy, which will help you heal and recover a lot more quickly postpartum. So when I talk about breath work, you may know already if you've watched my channel before, I'm a huge advocate for belly breathing where you're really filling your belly as you breathe, relaxing everything, your pelvic floor, your abs, everything as you inhale, and as you exhale, you're hugging baby with your abs, you're squeezing your pelvic floor muscles up and in, and you're really using this breath work with every single exercise that you do. That way you're always strengthening your abs and your pelvic floor. Before you even lean onto the wall, I want you to really take a big inhale where you're filling up your belly muscles, you're letting your abs relax, you're letting your pelvic floor muscles relax, letting it all go. As you get in position on the wall, that's when you're going to exhale through your mouth, you're gonna draw your pelvic floor muscles up and in, hug baby with your abs, squeeze those deep core muscles, and really engage everything. Here you're going to inhale, fill belly, and then as you exhale, draw in your belly, you're going to bring an hand to your shoulder. Inhale, fill belly. Exhale, draw belly muscles up and in, tap right shoulder, tap left shoulder. Inhale, relax pelvic floor and abdominal muscles. Try to stay as straight as you can. You can see my butt was lifted up a little bit there, but I'm trying to get in a nice straight plank position. So again, you're going to inhale, fill, relax. Exhale, draw belly in, pelvic floor squeezes up and in. Tap your shoulders one at a time. Inhale, relax belly and fill, pelvic floor. Exhale, draw belly in, squeeze pelvic floor up and in, and nice, slow, controlled tap right and left shoulder. If you want to learn a little bit more about diastasis recti, why we really advocate for exercise to keep your ab muscles nice and strong during pregnancy, I highly recommend you check out this video here. It's all about what diastasis recti is and why we don't want it to get any worse during your pregnancy. That would be a great next step for you. Otherwise, thanks so much for watching today, and I will see you all in the next video.